So after you
Yeah.
finished treatment and you were going along your merry way until, right?
Yeah. Well, I had another brush with cancer. It was a mucosal melanoma, and
Okay.
that was anal. Um, I started having bleeding and
Mm-hmm.
very painful pains back there. And so
Mm-hmm.
I went to a very good gastrointestinal doctor.
Uh-huh.
Unfortunately, he put me with someone that was young. I think he was probably just out of medical school, maybe.
Mm-hmm.
He was very nice, though. And he looked there and said, "Oh, you have an anal fissure, a
Mm-hmm.
fistula, and
Mm-hmm.
just above the sphincter muscle. And that
Okay.
was causing the bleeding.
Mm-hmm.
So they were just treating me with a cream,
Mm-hmm.
but the pain and the bleeding continued. I got
Mm-hmm.
weaker and weaker, and this went over a time of about 2 months.
Oh gosh.
And then finally, I couldn't eat anymore. I couldn't drink. I was so
Mm-hmm.
dehydrated and weak. So my wife called the ambulance one Sunday. I went to the hospital.
Mm-hmm.
They did blood work and they said, "Oh, you're fine. I don't know what it is." But then they said, "Let's do an MRI, I'm sorry, a CT scan just
Mm-hmm.
to make sure." And when they did, the results was I had cancer all in my pelvis. They called
Mm-hmm.
it peppering. It's all little mini, like mini tumors. And
Okay.
then in my liver, I had four big ones. And
Mm-hmm.
then on my anal sphincter, I had a growth.
Okay.
So when the doctor came in, I was still naturally in the emergency room
Wow.
where
Mm-hmm.
when they brought me in, and he said, "There's nothing we could do with you here. I'll give you about 5 months to live." And
Oh
he
my
said,
gosh.
"We're going to unhook you from the IV and you can go home."
Mm-hmm.
So with that, I was very depressed. As a
Mm-hmm.
matter of fact, I was 80 years old. That was in December. So
Mm-hmm.
I was 80 and I went home and I said to my wife and my youngest boy, I said, well, I had 80 good years and, I faced it like that. I
Mm-hmm.
figured that was the end. But anyway, I got another doctor and
Mm-hmm.
a regular concierge doctor.
Okay.
And she said, let's go further. So I got a proctologist. He
Mm-hmm.
sent me in for a colonoscopy. And when I came back, he said, you have a growth there. So they sent
Mm-hmm.
it out and had biopsies done at
Mm-hmm.
different institutions. And it
Okay.
came back mucosal melanoma, which is
Okay.
very rare. Only
Mm-hmm.
1% of people get it. That's roughly 700 people per year in the United States.
That's
So,
all. My goodness.
so they sent me right in for 5 rounds of radiation to that
Mm-hmm.
area. And I'm telling you, I was in such pain before that for like 3 months. And they were giving me all kinds of opioids and
Mm-hmm.
pain pills, nothing touched it. But
Mm-hmm.
after the second radiation treatment, the
Mm-hmm.
bleeding stopped and the pain went away. I
Oh my
couldn't believe it.
goodness.
It was like a
Wow.
miracle. So
Mm-hmm.
I had the treatments, 5 radiation treatments, 5 days in a row. And the following Monday, I started Opdivo.
Mm-hmm.
That's a cancer infusion drug.
Okay.
It's a new immunotherapy drug.
Mm-hmm.
They've come a long way in my 5 years since
Wow.
then. But
Mm-hmm.
within 5 months, it killed all the cancer cells. It wiped them all out. The radiation took care of the anal fish tumor. That was
Okay.
my main one. That took that out right away. So
Goodness.
I was very fortunate. So I continued on immunotherapy for
Mm-hmm.
2.8 years. They
My
only recommend
goodness.
2 years,
Okay.
but I kept going.
I
you
got
know,
to ask you about this for a couple of things. One, so you never had surgery then of the tumor that was in
no,
the anal area. The radiation shrunk it completely or enough that that's
yes.
amazing. And then that added to the immunotherapy wiped out whatever cancer was there. And you even went
yeah,
some extra months. I guess they saw how successful it was. They wanted to be absolutely sure they got everything. But what
yeah,
amazes me is you and your character and your ability to hear. First, one doctor's treating you for a fissure, and then you realize this has got to be more than that. And thank goodness your wife got you into the emergency room. But then he
yeah,
gives you a death sentence, basically, 5 months, and get your affairs in order, and you're
yeah,
accepting it for what it was, grateful for the life you had. But this next doctor said, "Let's go further." That's amazing. Were
yeah.
you surprised by that, or when he said that, did you at any point think, "Boy, these other doctors didn't take care of me," or were you always just positive and moving along? How are you dealing with all of
No.
that?
Well, I learned over the years you have to be your own advocate.